Can GLP-1 medications help treat addiction? Originally developed for type 2 diabetes and obesity, GLP-1 receptor agonists, GLP-1RAs, like Ozempic, Wegovy, and Mounjaro, are now being explored for something entirely different, helping people recover from addiction. So, what are GLP-1s and why do they matter in recovery? GLP-1s mimic a hormone, glucagon-like peptide 1, that helps regulate blood sugar, appetite, and digestion. But what's capturing the attention of addiction researchers is that GLP-1 also acts on the brain, specifically in areas tied to dopamine release, reward processing, and impulse control. These are the same areas hijacked by addictive substances like alcohol, opioids, nicotine, and cocaine. In other words, GLP-1 medications don't just reduce physical hunger, they may help regulate psychological craving. What is the research saying about GLP-1s and addiction? Recent research, both clinical and observational, is compelling. Animal studies show GLP-1 receptor activation reduces alcohol consumption, drug-seeking behaviors, and the rewarding effects of cocaine, amphetamines, opioids, and nicotine. A 20-year population study in Sweden found GLP-1 users had fewer alcohol-related hospitalizations, sometimes outperforming existing treatments like naltrexone. At Penn State, researchers found that GLP-1 medication, liraglutide, reduced opioid cravings by 40% in early human trials. Studies suggest GLP-1s influence the mesolimbic dopamine system, particularly the ventral tegmental area and nucleus accumbens, the core of our brain's reward circuitry. While more research is needed, GLP-1s could one day offer reduced cravings for substances, lower reward sensitivity to addictive triggers, and possible support for weight stabilization and appetite regulation in recovery. You might be wondering what some of the risks and considerations are. Right now, GLP-1 use for addiction is considered experimental. There's promise, but there are also important cautions. Considerations for the general SUD population, limited evidence, cost and access, side effects, serious health risks, and superficial craving. Suppression for clients with co-occurring eating disorders. Consider that appetite suppression may worsen restrictive eating patterns. It can lead to trigger body image issues or unhealthy weight control behaviors. It may worsen malnutrition, electrolyte imbalances, and psychiatric symptoms, and there is a risk of misuse for weight loss rather than recovery support. We believe in innovative, evidence-based approaches, but also in safety, ethics, and the whole-person model of care. If GLP-1 medications are ever integrated into addiction treatment, it should be only after thorough screening for eating disorders and medical stability within a multidisciplinary team, medical, psychiatric, nutritional, and should be alongside therapy, peer support, and holistic recovery services. At Sobriety House, recovery isn't just about stopping use, it's about healing the whole person. GLP-1 medications might someday be another tool in the toolbox, but like all tools, they work best in skilled, compassionate hands, and never as a replacement for the deep, ongoing work of recovery. Recovery evolves, just like people do. We invite you to stay curious with us. If you or someone you know is seeking support for addiction or ready to start rebuilding a life in recovery, we're here to help. Give our admissions line a call at 720-381-4337